All right, well, let's talk about research and how are we going to go from the questions that all of you guys have asked and are asking and will continue to ask. And in some cases, we've been asking for decades. How are we going to get to better treatments and one-day cures? And I mean that. We are not setting the bar at mediocrity here. We're going after the big burrito, the enchilada, whatever it is, whatever Mexican food of choice is your choice there. We're going after it. So let me talk a little bit about that. So I told you a little bit about this yesterday, but we are constantly listening to you guys. It starts with what your questions. And we take those questions to our meeting of the minds. We have a conference very much like this, but we hold it for clinicians and researchers, people who work in industry and academia, people who work in the government. And we say, these are the questions families are asking. How do we turn that into science that can actually answer the question? Scientifically, it's all about measuring something. Like, science is not a political argument. Their scientific method is make a hypothesis, test it, and then see if it works or not, and then repeat it. That's it. So which medicine worked better in this group and that group who were similar for these reasons? And you get an answer. And if you can replicate it, it's been shown. And I think that's what we're all looking for. We're tired of being the experiment. We want to know what the experiment was. And what's even more egregious is being the experiment, but not learning from that. I mean, how many times was my daughter on, 7 medicines for all different conditions with no knowledge whatsoever of how those 7 would work together across GI issues. And that's true for your loved ones too. And then once we get the meeting of the minds done, we can actually now form that into things like our 3 grand challenges and the questions that you guys ask. And then we have grant funding program at the foundation. So we can fund, it's called our Cure LGS 365 program. It's called that because 365 days a year, you can apply for a grant. You don't have to wait for June for our grant cycle. And we can fund the research that came out of the meeting of the minds to get answers to your questions. And then we can bring that information back to you. And we're lacking a little bit of information. We're still collecting data, but we want to start bringing that back to you as best as we can about what is the answer to your question. So hopefully by the end of this talk, you'll realize that this loop never stops and your next question starts it again. So what are some of the questions? When we think about the 3 grand challenges, which are up here in a colorful manner, the first one, like, why did this happen to my child? What is actually broken in the brain? Could we have gotten ahead of this and stopped it, just like Kurt asked? Can we finally get a treatment that doesn't simply target the single symptom of seizures, but either targets something more beyond just the seizures, or better yet, down the road, and this is going to take some time, targets that fire in the brain. And remember, the fire in the brain is LGS, and the fire is not everywhere. It is in the same place in the brain in each person with LGS, and we can go after it, and we are. And then for care for whole life, will my child ever sleep again? What happens as they get older? Who's going to care for them across their life? And then the one that I think we all struggle with is, could this disease ultimately take my child? We've had 3 meeting of the minds so far, and we listened there as well. Our first one was finding those disease-modifying therapies. That was in 2021. So we've been building this plan, these 3 grand challenges we've been building since then. The second one was on doing better clinical trials. And then the third one, which we just had last year, was on care across the lifespan. And we bring families like you, like Kurt, who are interested in research into these meeting of the minds to talk to the clinicians, the research, the government people, and the industry partners to turn your questions into answers that can be tested scientifically. And out of these came our brand new 3 grand challenges. In the last decade, a little over a decade, since 2014, we have now funded $3.1 million in research and 20 plus projects through our Cure LGS 365 programs. Real scientists, real projects. And this is so important because in 2014, the dogmatic way of thinking about LGS was, there's nothing we can do, go home and love your child. And that is not the message you're getting here today. So in a decade, this group of people, have changed the minds of a group of researchers who are now pioneering better treatments and cures, because we wouldn't take go home and love your child as an answer. So what does that mean? What are we funding? Understanding it. We want to understand it. what is actually broken and why my child, and how do we fix it, and could we have stopped it? What does this mean? So today, through the grants that we have funded, which you can learn more about on our website, we can build LGS in a dish, we can build it in animal models, we can recreate the brain waves that are seen in every person with LGS, and we can name the gene behind many of them. And for those of you who don't have a genetic epilepsy, for the traumatic brain injuries, those are being extensively studied as well. Because when a brain has trauma, it then enters into this whole process where the brain begins to change and the LGS network begins to form and the little sparks happen until the fire sets. So the same thing that happens when a gene perturbs the brain happens when a traumatic injury perturbs the brain. It's called the genesis of epilepsy or the genesis of LGS. And that is being studied as well in patients who have traumatic brain injury. So it's not just the genetics. Where are we going next with this? How do we understand it? We are going after that LGS network. We're going to look at tissue from willing volunteers who are willing to donate a small amount of tissue. Sometimes when you have a deep brain stimulation and they put in the electrode and they pull it out, there's a little tissue that is left on there. And if we can get tissue from where the seizures are starting in the brain, which is where they go through, to implant some of these deep brain stimulators, we can study that and figure out what's wrong with it. We can figure out what proteins are misbehaving, and we can go after them as drivers of LGS. And we are doing that in the cortex and in the thalamus for people who are willing to participate in these studies. Now, this hasn't started yet. We're getting like IRB approvals. The doctors are setting it up, but this will be a game changer for us. In addition, we have these mouse models where doctors and researchers can go in. Where is the abnormal brain wave in the mouse coming from? Remember, the mouse has the same abnormal slow spike in wave that our loved ones do, and figure out where it's coming from in an animal. And we can do this in a dish as well. We can create neural networks in a petri dish, and we can study those and how does the genesis of LGS happen. And all of these things are beginning to come to fruition through the work of this foundation. Treating it. Will a treatment ever change the disease? We're going after that today. So I'm going to tell you honestly, today, what we're looking for are treatments that target more than just the seizures. We want to be looking across the whole person. But tomorrow, down the road, when the science is ready, we want treatments that will target that fire and put it out, preferably before it starts. This is going to take a long time. But today, we can do better on treatments. And I saw, like many of you in the very beginning, I'm like, what is worse, the seizures or the medicines? And there was a moment in our journey where Savannah was on the same number of medicines and her seizures spiked, as they do in LGS. And when her seizures spiked, we almost lost her. And the medicine saved her life. And over the next 30 years, I would see these medicines save her life over and over and over again because the seizures are worse. People with epilepsy and had seizures before medicines actually died a lot younger. And even though we don't have really strong data, they do keep your loved one alive. They used to run epilepsy clinical trials, and they used to be very, very long, months and months long. And the FDA shortened them because if you were in the placebo arm of a trial when they used to run these long trials, you were more likely to pass away from SUDEP. And so they shortened trials. And so we know that these medicines, we know that leaving seizures unchecked is dangerous. And so we know that these medicines suck and they're awful, but we also know that they're saving their lives. And two things can be true. Where do we go next? We're going to move towards the network-targeted gene-modifying therapy, and then we work with all of these companies that are going to be talking today to try to design better treatments today until we have those disease-modifying therapies tomorrow. How do we get ahead of it? Well, it turns out when you talk to doctors like Dr. Perry and Dr. Shellhouse and all the doctors that have been here speaking, they will tell you that when they're seeing their patients, they can tell when they look like they're going LGS. We have funded several grants to quantify this, and we can find these kids. And as soon as we publish those papers and we find the group of doctors that are willing to do this, we're going to start doing treatments in people who are going LGS. We'll have a group that goes on this treatment and a group that goes on that treatment and a group that doesn't go on anything because they chose that they didn't want to be in the study, and see if we can prevent LGS with currently available treatments. So that is coming. Can we prevent it before it starts? Living with it. Will they ever sleep better? What is it going to like when they get older? what we're doing here is we have a sleep researcher that we funded. Dr. Gupta is coming to speak up here today. And so we're really pushing sleep, not as a comorbidity. We talk about lung issues and behavior issues and all of these things, but sleep gets elevated a little bit because it is a necessary function of life, right? If sleep is not just a nice to have, it's a must have. How can we expect behavior to get better? And how can we expect speaking to get better when none of us are sleeping? I haven't slept in a couple days and I can barely get my words out sometimes, right? So we've got to go after sleep, and we're doing that in the grants that we fund. In addition to that, we're looking to standardize care. Dr. Perry spoke about this yesterday. Across, the hypothesis is if we all just started, instead of all of us, there's 40 treatments for epilepsy out there, and we all go on them at different times. But what if we all went on one? And we compared it to a group of people who were on all 40, just whichever one the doctor felt like putting them on. And we started to tease out which one's the best for people with LGS. And none of us have to go on this 40 treatment journey because you'll know you went on the one that was tested the best. Okay, it's not gonna work for everybody, but we'll get there. But why do all of us have to try all 40 in a random order? And why are we not learning from our loved ones as this is going on? Well, that's over. We're learning now. We're changing that. And in addition to that, we're starting to collect data from you guys as the families. Like all of the information that Kurt and his family have attained, he can now share in our LGS Learn from Every Patient database, especially our core study, which is surveys that you guys would fill out and tell us what your life was like so that we can then go tell the family what you've learned instead of having to do it this family and this family and this family. What if we pooled all of our stories and said, well, these 1,000 families tried adaptive behavioral therapy, and this is what they had to say about it. And powering it all is going to be this Learn from Every Patient database. These are going to help us to get answers now. There are people in here who have 40 and 50 and 60-year-olds with LGS that we need to learn from, and many of them are willing to share their data. And if you don't want to share your data, that is fine. You guys have your hands full with LGS. I understand that so well. But for those that have the time and the inclination to share their data, you can advise the next generation because the young ones, the people who have young ones in the room are wondering what life looks like as their loved one ages. And we can share that. And I just want to show you this in my last couple of slides. This is from the Prader-Willi registry. They have a Learn from Every Patient database of their own. They call it a registry. And as they get data in from the families, as they've filled out surveys, they put these infographics back out to them. So how many are on a feeding tube? And at what age did they get that feeding tube? And did it ever come out? That's the center infographic. If you look to your right, the one on the right is when all the kids with Prader-Willi developed their developmental milestones. We don't know when to expect our loved ones, if ever, to develop their milestones. How many of them don't speak at all? Will they ever speak at all? And then over on your left, they have a lot of problem with choking and vomiting and needing to give the Heimlich. And so they asked the families who had older kids, what's been the story for you? And then they bring the data back to you. And so as soon as we get to 100 patients with our current core study, the one you can sign up for and win a Sammy Cam over here in the breakfast room, we're going to put one of these out to you guys. It'll be our first of many of these about the questions you're asking. What happens when they get older? Where do they live? Are they living at home? Are they in group homes? Are they working? What are they doing? How long do they live? I remember when I met my first 60-year-old with LGS, and I'm like, what? They can live to 60? That's amazing. What's it like? Do the seizures get better? Do they get worse? Do the behaviors get better? Do they get worse? What are the doctors like? This is all stuff that we are ready to ask, and we hope you will answer and share to the next generation. It's like our family Facebook group, only the data all pooled together in one place. You could tell I'm really excited about it. The pipeline is full. We've got treatments coming out. We have 8 medicines that are already FDA approved for seizures and LGS. These have been tested in a super refractory, seizures just do not want to be controlled group of people. And so these are the go-to 8. We're working on this expert opinion. We're getting 30 experts from around the world who see LGS patients every single week to tell us how they treat and to come to some sort of consensus. What's the first one? What's the second one? When do you do this? When do you do that? And that'll be published this year. We hope by the end of this year, if not by Q1 of next year. We also have 10 candidates in clinical trials. We've got rescue meds that are actually FDA approved. I remember life before rescue meds. We were in the hospital all the time, every single week. And when rescues came out, we didn't have to. It's hard going to the hospital. Of course, siblings get abandoned. Nobody eats well. Nobody sleeps well. I mean, we're not getting sleep anyway, but now you're really not. And then we have these new frontiers with gene therapies, and then hopefully for the patients and families who are living with traumatic brain injury, anti-epileptogenesis therapies. So it is coming. A generation ago, families had almost nothing. Today, the pipeline is running. And so when we started funding this about a decade ago, we had nothing and no answers. So that's where we started. In fact, when we originally started our first campaign, it was called Behind the Mystery of LGS. And here we are, a decade later, a network disorder that we can act on. And it is because people like you stood up and said, I want to help, I want to share my story, and I'm not going to just say that I'm going to accept, go home and love your child. We can do better. And our kids and our adults deserve better. So please, if you're willing, share your data. Please, if you're willing, share your story. Tell your story. If you're willing, keep asking, keep telling us, because the questions you ask help us to go to the scientists and say, we need these answered. And sharing your data can be as simple as leaning over to the family next to you and saying, hey, I had a DBS put in. Let me tell you about it. We had it done 2 years ago. You're thinking about it? This happens on our private Facebook page every single day, so you guys can join that.